Hello everyone, and welcome to Future, where we explore important topics to help you create a better tomorrow. Today, we're discussing drug addiction, a complex and devastating disease that affects individuals and society as a whole. Drug addiction, also known as substance use disorder, is a chronic disease characterized by compulsive drug use despite negative consequences. Addiction can affect individuals of all ages, races, and genders and can be caused by a combination of genetic, environmental, and personal factors. Genetic factors may play a role in addiction, as studies have shown that individuals with a family history of addiction may be more susceptible to developing addiction themselves. Environmental factors, such as exposure to drugs at an early age, living in an area with high drug use, or experiencing adverse childhood experiences, can also increase the risk of addiction. Recent research has shed light on the impact of social determinants of health on addiction. Social determinants of health are the economic and social conditions that influence an individual's health and well-being. Studies have shown that individuals living in poverty, experiencing homelessness, or lacking access to healthcare or education may be more susceptible to addiction. The effects of drug addiction can be devastating and far-reaching. Physically, drug addiction can lead to heart disease, liver damage, and respiratory problems. It can also increase the risk of overdose and death. Psychologically, addiction can cause depression, anxiety, and other mental health disorders. Socially, addiction can lead to job loss, financial problems, and relationship difficulties. Addiction can also increase the risk of criminal behavior and incarceration. Recent updates in the field have highlighted the impact of the opioid epidemic on addiction rates and overdose deaths. Opioids are a class of drugs that include prescription painkillers, heroin, and fentanyl. In the United States, the opioid epidemic has led to a significant increase in overdose deaths, with over 90,000 deaths in 2020 alone. Treatment options for drug addiction vary depending on the severity of the addiction and the individual's needs. The most effective treatment approach is usually a combination of behavioral therapy and medication-assisted treatment. Behavioral therapy, such as cognitive behavioral therapy and contingency management, can help individuals develop coping skills and change their behaviors. Medication-assisted treatment, such as methadone or buprenorphine, can help individuals manage withdrawal symptoms and reduce drug cravings. Recent updates in the field have focused on expanding access to medication-assisted treatment for opioid addiction. The Substance Abuse and Mental Health Services Administration, SAMHSA, has developed guidelines for the use of medication-assisted treatment in opioid addiction, including the use of extended-release naltrexone, which can be administered once a month and does not require daily dosing. Other treatment options include residential treatment programs, which provide a supportive and structured environment for individuals to focus on their recovery, and support groups such as Alcoholics Anonymous or Narcotics Anonymous, which provide peer support and encouragement. Recent updates in the field have also highlighted the importance of providing comprehensive care for individuals with addiction. This includes addressing co-occurring mental health disorders, providing access to medical care and social services, and addressing social determinants of health. It's important to remember that addiction is a chronic disease, and recovery is a lifelong process. Relapse is common, but it does not mean that treatment has failed. With the right support and resources, individuals can continue to work towards long-term recovery and a better tomorrow. In conclusion, drug addiction is a complex and devastating disease that affects individuals and society as a whole. It is caused by a combination of genetic, environmental, and personal factors, and can have severe physical, psychological, social, and legal consequences. However, effective treatment options are available, and recovery is possible with the right support and resources. Thank you for watching this video about drug addiction. If you or someone you know is struggling with drug addiction, please seek help. There are resources available to you, and recovery is possible. If you found this video informative, please consider subscribing to our channel for more content on addiction, mental health, and personal development. By subscribing, you'll be notified of our latest videos and can join our community of like-minded individuals committed to positive change. Thank you again for watching, and we'll see you in the next video.